Next up is actually an exciting, exciting keynote, so you do not want to miss that for just a cup of coffee, ladies and gentlemen. Let me tell you, the value here is on stage coming up. But you will get coffee eventually, that too. Just got to hold on a little longer. Nonetheless, we got so much excitement building. So next we move from, we talked and heard about the importance of the ecosystem, the importance of having everyone in the room. Now we're shifting gears. We're moving to a different level, the individual level, and the individual human performance, and what can be learned and studied when you expose humans to the extremes, to environments where you and me, perhaps, or at least me, wouldn't last a day. What am I talking about here? We have Jack Kreindler coming up very soon on stage. He's a physician and he's an extreme environments researcher. He's been to every continent and just about every remote corner, especially there where the extreme of human capacity can truly be tested over time. Studying how we can build hyper-resilience, and from that, understand how we can increase our health span and live life to the very fullest for longer than expected. Ladies and gentlemen, please put your hands together for true highlight, Jack Kreindler. Welcome on stage.
Okay. Billions of years ago, an interdimensional species of hyper-intelligent beings got terribly fed up knowing everything there was to know about the universe. And so they built a stupendously powerful supercomputer that spent 6.8 million years computing the ultimate answer to life, the universe, and everything. And it came back with the answer: an excellent, educated audience. Which, for those of you who don't know, was the brainchild of the late, great Douglas Adams, writer of The Hitchhiker's Guide to the Galaxy. And it illuminates for us the difference between knowledge and wisdom. But that is a talk for another time. Douglas was obsessed with exponentials, and it was with myself working with him whilst I was still at medical school that I realized that computation and AI would change the whole face of the profession that I was about to enter into. And when thinking about these exponentials and where they're going into the future, we've got to look into the past. This is where we were 100 years ago, with marketing like this from Squibb, and people like Kellogg saying that breakfast was the most important meal of the day, when in fact we know that it's not. Fast forward 100 years, and we have AI everywhere. We are folding proteins. We are at a stage where we could go from first case to vaccine in 100 days. We are able to see plaque before it becomes a fatal killer and do something about it. This is mind-boggling progress. But where will we be 100 years from now? Well, to answer that, we actually have to go back past Hippocrates to my favorite point in history. Yeah, I think you guessed that I like sci-fi. Let me explain. Who's this? Thank God, another very, very good proof that you're an excellent audience. Okay, let us to see why Darth Vader is representative of the future of technology and the future of healthcare. There's no sound, unfortunately. I think we might need some sound. He had 100% burns. he had multi-organ failure. He had no arms and no legs. He had some psychological problems. He had some minor issues. And of course, he had, and I'm very, very sorry that you haven't got the sound here, he had either asthma or COPD, but we didn't actually get to the final diagnosis. It would be really good to get the sound working if at all possible, because this is actually quite a lot of fun when you hear it. Anyway, but it wasn't. It's impro. It's okay. All right. But it wasn't him. It wasn't Darth Vader, of course. It was his line manager that really made a difference. So this is Ian McDermott. He is famous for playing the Emperor in Star Wars. And it was in 2008, this is public knowledge, that he was on stage at the press opening of 6 Characters in Search of an Author, and he suffered acute cardiac event, and his managers called me up and said, look, you put like loads of sensors on everybody, and can't you just tell whether our people are going to be having a problem like this? And it was actually true. By the way, this is just a very small aside. This is the Emperor himself, and it's the most important text message I've ever received. But I don't actually work on the Death Star. I just sort of want to point that out. It's just, yeah. Anyhow, in my institute, where I really do work, we study human performance, and we use biosensors, and we use data, and we use predictive analytics to try and find out when people are going to thrive or fail, and hopefully keep them out of the hospital and winning things and doing things that really are beyond what humans are capable of. We work with boxers, athletes, transatlantic rowers, people that generally do very, very bizarre things. We have done Eddie Izzard's 43 marathons in 50 days, Dave Walliam swimming the Channel. I've been thrown in cage fights with heavyweight cage fighters to study whether rest, ice, compression, and elevation work. I lost. And we also do very, very serious work as well with cancer patients, with people who are critically sick, in order to understand people in extremes and what are the ingredients of survivorship. And indeed, aging is an extreme condition. So we translate that work to the extremes of aging. And we collect a lot of data. This is a real does anyone have an Aura ring here or something like that, a Whoop? Okay, a few of you. You know the VO2 max thing? This is a real VO2 max. Okay, this is the kind of crazy data that you get from a proper VO2 max test, and it's phenomenally predictive of when it is that your final breath will be taken, notwithstanding being hit by a car or other diseases. And it's a very, very powerful tool. It is kind of a measure of your life. And we've been using it in elite sport for ages and extreme environments. And so we collect an awful lot of data. This is a typical consult screen for one of our patients. It's a lot. And you don't have to worry about it. We worry about it. But this goes to show the amount of data that we use. And it's not too dissimilar, really, to the aviation industry. A typical Airbus A350 will produce 100,000 pages of A4 report per flight. And interestingly, if you look at the aviation industry, it produces about 300 billion pages of data per second. That's a lot. And this is where we were with data when I was born, which is height and weight every year. Well, that's cool. That's surely, I mean, would you get in an airplane that hadn't been checked for its vitals until it was 50 years old? No. Okay. But that is the reason why we in healthcare are not very safe. I'm getting there. Daniel opened this event yesterday, and there's me at his event top left with a big grin on my face, accidentally having ended up at Singularity University, starting to realize and know that the whole of my career was going to be changed because of data from devices. This is where we were in 2012. We've obviously advanced a lot, and we've used these devices in in people doing very, very extreme things. This is Alan Shearer and Robbie Savage sitting on every seat in Wembley Stadium, and we were able to tell with a biosensor who was going to win way in advance of of the actual end. And going back to Ian McDermott and his event, it would have cost us about $10,000 a day to strap him up with the latest technology in 2008. How much do you think it costs today to get this kind of data beamed from across the world to an AI that can interpret it for you? Any guesses? With the actual physical devices as well, it's about $1 a day. I mean, it's just mind-boggling what is happening. And yet, are we implementing this is the big question. Back in 2008, we strung together a few pieces of tech and came up with a very, very cool early warning system for those with complex chronic disease. Again, using these kinds of data and analytics, able to detect many days in advance whether someone was going to come crashing into hospital that had COPD or CHF. And these things are now quite usable. They're not sort of just the things that elite athletes are using. These are things that are starting to be used in healthcare systems. That project was called Jointly. We had to change its name because people started calling us up for marijuana and hip replacements. So we called it something else. But what is the actual cost, and what is killing us? You know, what are the things that we need to address? And this is no surprise. It's heart failure and it's heart disease. It's neurodegeneration, much, much harder nut to crack. Complex diabetes, I think we're well on our way to being able to do that. Cancer early detection, yes, I think we're moving well with that. COPD and asthma, difficult because of the environment and still behaviors. Inflammation and immunology, we're getting ahead of. Physical frailty is something which we realize is actually a really proper problem and a disease, which is good. Mental illness, another hard nut to crack. And the other things, of course, which are killing us are addiction and rejection. So, and also the actual prescription of things that make us addicted. So these are the things that are actually killing us. And can data fix it is one of the big questions that we have. Well, it has to try. Because in the US, I mean, I think this is probably paralleled with Europe as well in proportion. We're talking about a $5 trillion spend, and it's not very effective. And most of it is because of aging. And Larry talked about this, that this is really the big epidemic. This is the Hallmarks of Aging updated paper, which I recommend you read, Ortiz et al. And we're beginning to understand the science of this. We're beginning to understand fundamentally why it is that we age and why we accelerate our aging because of our lifestyle and because of poor access to medicine. And it turns out that it's really, really complex. It's not something that a single human brain can compute. Does everyone remember this? This was Roche's metabolic pathway map from the 80s. Does everyone remember this? This is one tiny fragment of one tiny bit of one cell, right? And there are 38 trillion cells which are all doing much more than this diagram and talking to each other all the time. Life is complex. We can't do it with human brains alone. And if life isn't complex enough, then guess what? The health system's complex. And if that's not complex enough, then there's politics. I like Photoshop. Okay. But we shouldn't panic. Extremely difficult times, which we are facing, are also extremely helpful times. COVID is a near example of this, and it changed everything. Why? Well, it helped us realize health insecurity. Wearables and apps suddenly took off. Digital healthcare became the norm. Self-testing and self-directed healthcare suddenly became something we all started doing. We were all doing lab tests at home. Who here still has tickly noses as a result of sticking things up their nose? I mean, yes. And of course, the longevity meme is a profound thing that has now come up, which is a reframing of prevention. It's aspirational, it's positive, it's interesting. So these are the 5 main things that happened over COVID, and it just changed a lot. During that time, people were banned from this. This is the first British festival that we were involved in helping to reopen. And that was a little project that we did using biosensors and self-testing to show that human beings, us, we can actually outperform laboratories if guided on our own to do things. Tech can do this. AI, technology, video, smartphones, we can be as good as labs at home. And we published a bunch of papers on this, and it really sort of, for me, felt like a Skype moment in that, wow, we can actually have a whole thing in our control that is normally a matter of a profession. And it was actually founded by myself, Lise Narusk, and one of the co-founders of Skype, Tarvet Henriques. Another thing to bear in mind is that extremely difficult jobs can teach us a lot about what we need to fix when we become difficult patients. The current main work that we do is an international health service called Wellfounded, where we take people who are really pushing the boundaries of what people do at work, and we notice that there are lots and lots of things that, whilst being brilliant in your jobs, you're probably destroying your bodies, and they're things that you can easily fix, even if you're very, very busy. It's about prioritizing, and it's about making sure that you are incentivized and realize that health also means more productivity and a better business as well. And we work with a bunch of companies doing that and have very proudly published and open sourced our work in this area. And it proves that small things make a massive difference. So extremely difficult challenges are also something which I obviously am interested in. This was a 2022 to 2023 expedition to the South Pole. It was the largest expedition to the South Pole in history, actually. 19 people, 10 coast to pole, 9 last degree, and we studied 17 million strides worth of skiing data from these individuals, trying to see why people survive and thrive in different environments. It was a lot of data. We measured loads of stuff before and during and after. We really took wearables and extremes to the very edge of their capability and learnt that, guess what, at minus 40 degrees, it's quite difficult to put an Oura ring on a charger. But that's something that older people face every day with neuropathy and arthritis. And so, we tech guys, and we're constantly designing stuff, but are we really appreciating the real world usage of it? That is a key question. And we also measured a lot of genomics and a lot of other biomarkers and data that's usually now the kind of remit of the longevity world. And we found out some very interesting things that when you put yourself into an extreme, it's not actually your body that is the most important piece. It's actually the people around you. So the greatest determinant of success on such extreme expeditions is, you want to call it your social network or you want to call it your expedition team. It's the people that you share load with. That was the single biggest component of success in these extreme environments. And I think the Harvard longevity study and a lot of the blue zone work showing how people live well into their 8th and 9th decade of life, the biggest single factor is, in fact, who you're with. I'm not going to be able to do the voiceover for this, which is a real shame, because this is a video which I wanted to show you. But I'll let you have a little glimpse of some of the environment that we were exposed to. It's now not working. You see, AI is easy, but AV is hard. I mean, this is a key problem. It was very cold. There was nothing anywhere. I'm giving you the video. There were no pubs. And you had to work with each other to survive. But one of the key things that maybe I can just whiz over to here and see if this will work. This is me talking about the use of biosensors and how we measured blood glucose and everything throughout the whole trip. But one thing I did want to show you is this. Just at the end here is a little reportage from a really cool guy who was one of the expedition participants. And he didn't turn up to dinner once. And we wondered where he'd gone. And then he really didn't turn up, and we wondered whether we'd lost him. It's very hard to lose people. I mean, there's nothing. It's just an epic white disk of nothingness that you're going on for hours and hours. And Nico didn't turn up because he was kind of unconscious next to his tent. Nico decided that he was going to try doing the South Pole keto. You don't do keto when you're going to the South Pole. It doesn't work. You need sugars, you need calories. But it does lean on one thing, which is that we were able to tell that he was hypoglycemic. He had a blood sugar of 2.8. Would anyone be scared with a blood sugar of 2.8? Yeah, you'd be squeezing in dextrose okay, so we don't have that. So whilst there is great promise in self-experimentation, the longevity movement, I do want to point out that you don't want to be the first person in the peloton when it comes to longevity medicine. Okay? You want to be in the slipstream of the people that are either doing the great science or experimenting on themselves and looking very closely at what they're doing, but be in their slipstream. There is a whole bunch of stuff that people are trying which can lead to problems. And we're slowly learning more and more about what the science really is from extremes. And that, I believe, is the real science. We took a lot of scores of people. The left shows how basically difficult it was from a sleep score perspective. And the right-hand side shows how difficult it was from a perception of effort perspective. And that, it was hard. The South Pole was really, really very, very hard indeed. And we came away, though, with the final result, which is on the right-hand side. Despite people feeling inspired and interested and active and excited and enthusiastic and proud and strong and all of these things, they didn't really feel any sense of hostility or shame or upset or being afraid or being nervous. It was one of the hardest things you can possibly do, okay? That's the left-hand side. But the right-hand side showed that actually the main components of making such an incredibly tough thing easier is by having teammates. It's not just about physiological fitness. It's about having family around, it's having team around. It's about having strength of your network around. And that is what makes something which is so unbelievably difficult easy to get through. Okay, here are some of the papers that we've published on that. Okay, so I think it's evident that we all want to live, and we want to live well. But I would say that we want to live extremely well, and we have to. If we want to have the physiology of a 60-year-old when we're 90, we need to be extremely well. We need to have a VO2 max of 150% of normal. It can't just be normal, and we're not doing it. And I would even argue, in fact, that not only do we want to live extremely well, but that we should live extremely well. We should, in my view, face the uncertainties that we are in, both politically, through our health systems, through the gerodemographic crisis. These are all extremes that we are living in, through the long, long ages that we will experience that our parents and our grandparents didn't. And we should all strive as teams to ensure that this life of extremes is not one that we hide in a cage and hope all the problems go away with. That we should face together and build health systems and build societies that can live together extremely well. Just to wrap up, please do not underestimate the power of exponential technologies. They are now here. When I first gave this lecture, they were 10 years away, and they've arrived exactly on time. Let's now implement them. Do not underestimate the power of extremely difficult times. They are our fuel to make change. And finally, do not underestimate the power of the dark side. Thank you.
Jack, thank you.
Sorry about the AV.
All good, all good. I think it was not your fault. I think someone probably in tech was sweating the whole time.
It's okay, we'll get Darth Vader on them.
Yeah, now we got, exactly. So you live in extreme environments, probably more often than many of us here. What do you think, your call to action was live extremely well. Help us understand, maybe also based on your personal story, how do you get to that place where suddenly extremes feel like the new normal?
Yeah, well, I mean, there's the daft way of living extremely, which is to go to silly places like the South Pole. But we all live in extremes. I mean, we are right now living in extremes of uncertainty. We are living in extremes of economic issues with how our health systems can support us, and we're also living in extremes of excess calories and excess sedentariness. We are just living in extremes, and most of us will, thanks to medicine, also be pushed into extremes of living to at least 85, probably 95 if you look at the actuarial tables, because of medicines that don't care for our performance and quality of life, but have been designed for elongating life. So we are all inevitably living in extremes. There's not much more you need to do. But if you want to come on a South Pole trek with me, I mean...
It's a standing invitation.
Yeah.
Well, I look forward to the break conversations that you're going to have with people. But so, as we do then live in the extremes, as you have defined it for us, what is it we should be doing, or what is it we should also be helping our patients with to better understand about dealing with these extremes?
So, foundational physiology is not the basics. It's the foundations, it's the fundamentals. Sleep, stress, nutrition, fitness, these are not four little words, and they're certainly not things that we're taught about properly in medical school, and we haven't really implemented in health systems or in medical pathways or in formularies. The science behind optimizing the foundational physiology of the human being is well known. We now have the tools such as AI to coach and help scale the professionals that don't have the skill set to really coach us through into making our bodies and minds work better for longer. But that is what we need to focus on. We need to focus on the kinds of things that are optimized in special forces, in expeditionaires, and in other people. Fitness. I mean, just moving. We talk about VO2, but do all of us understand the 5 components of physiologic fitness? We don't. Oh yes, there's a bit of strength, there's endurance, there's aerobic, there's flexibility, and there's neuromuscular. But is that really taught in medical school, and is that really pushed and taught by your GP? If we don't get that right, you can put as much pharmacological icing on the cake, and it'll just fall to the bottom of the plate. You have to build the base, and that's what I think the whole of health care needs to refocus on.
So if someone wants to start a jogging group tomorrow morning, I would be usually in, but these days I'm a little slower. But thank you so
Thank you very much.
for those insights and for really helping us think so holistically about
Appreciate
this
it.
topic.
Thank you.
Thank you.